Hello. In previous videos we have seen how to deal with patients with abnormal results and how, if we want to be sure that we check the results next time whether or not they're out of range, we can set their risk class to watchful wait, and that will prevent the Dawn auto review process from automatically moving them on if all their results are in range. But if we do that, how do we find those patients when they come back, if everything is in range? Obviously, if some of their tests are abnormal, they'll appear in our abnormal count here, in our abnormal list view. But if everything is normal, everything's ostensibly fine, but Dawn's not going to roll them forward, how do we look at them manually? How do we find them and deal with them? Well, that on the dashboard is what this count is telling us. Patient records waiting to move to next appointment. Dawn isn't able to move those forward automatically. They're the people we need to look at. And as I can see, at the moment, I have 3. So if I click on here, it brings me to the work list view, but this time I have the due for move to next appointment filter selected. When we were looking at abnormal results, we were using this filter. Now we're using this one. And I can see that these patients are actually grouped by their risk class. And I'm only really expecting to have watchful wait patients in this list, because that's the risk class, if you remember, which is configured to prevent auto review from closing the visit. All our other risk classes at the moment allow auto review. But what can happen is that you can have all your mandatory results come in over the interface, so your full blood count, your UNEs and your LFTs, but you may have an optional result, for example like the ESR or the CRP, that comes down an hour or two later. And if auto review is running all the time, what the risk is that it finds those mandatory results, they're all in range, it closes them and rolls the patient forward to their next appointment before the ESR arrives. Now that isn't really the end of the world, because if the ESR is out of range, it will actually go against the next visit and be flagged, so you will see it. And if it's in range, it will sit against the next visit, but pretty much be ignored until it's superseded by a later result for the ESR. However, when you look at that record, it can be slightly confusing, it's a little bit messy, and it's better if everything is nicely ordered against the correct visit. So for that reason, what we often do is make auto review only run for a couple of hours every night, and that diminishes the chances of that happening. What it does mean, though, is throughout the day, you can get patients who get a full set of mandatory results that are all in range and won't be auto-closed till this evening. So normal running, what I would do in here is look for the watchful wait patients, because those I need to deal with. Anybody else, any other risk classes, I would just keep an eye on, and if that list is getting longer and longer, then maybe call the Dawn support team to find out whether auto review is actually working. However, if that list is sort of very short, has nobody in it first thing in the morning, it gets a little bit longer during the day, but is back to having no one or only 1 or 2 first thing, then that would be normal. That would be fine. So let's assume that's the case. Auto review's working. This patient will probably be auto closed tonight. That's what we expect. The watchful wait patients, however, I need to deal with. So let's click on one. And here we go. Yep, we can see everything's in range. Good to go to that. But what I need to do is just check what the reason for having tested them again. Okay, we see the ALT was high. and we put in a note here saying hold dose and retest in 1 week. Check with Dr. Dawn that she's happy to restart medication. So we've actually suspended medication, everything's looking good, but are we going to just resume or are we going to make a change? Now, I can speak to Dr. Dawn and find that out and do whatever I need to do. Or if she's not available at the minute, I can of course add a referral. Say, all in range, please advise whether to restart medication, and if so, should it be the same dose? Okay, what we can do is do that. Just do it to the doctor's team. They're now referred. This has gone red because they have an open referral. And I come back to here. Oh, there we go. And they're no longer in this list view. They're no longer ready to move to the next appointment because they've actually got a referral. And so they're now showing on the referrals list. If we go back to the move to next appointment, what I can do, perhaps this patient, it's more clear cut. We actually haven't stopped anything. We just wanted to check that there was nothing odd going on there. There doesn't seem to be. So that's okay. So that one I can just close and we resume normally. So that's good. Apart from actually they're still on watchful wait, and perhaps I want to put them back onto the normal risk class now, so they will auto-review next time. So now I've only got this patient left. We're expecting them to be auto-closed tonight, so I can just close out the list view and they're dealt with.